Imagine a mineral that can both protect your teeth from cavities and damage your bones if taken in excess. Sounds surprising, right? That mineral is fluorine, which is present in our body mainly as a fluoride ion. That mineral, fluorine, is one of the most important trace elements in the dentistry and community medicine because an appropriate amount prevents the dental caries and while excessive intake causes fluorosis. In today's lecture, we will study the fluorine in simple and conceptual manner. We will cover introduction, RDA, sources, deficiency, toxicity, biochemical functions. Important MBBS exam points and let's begin. First of all, what is the fluorine? Fluorine is an essential trace element present in our body mainly as a fluoride ion. About 99% of fluorine is stored in bones and teeth where it strengthens mineralized tissues. Unlike calcium and phosphorus, fluorine is required only in very small quantity, but it plays a major role in maintaining dental health. One interesting fact is the fluorine ion can be both beneficial and harmful. At the correct concentration, it strengthens teeth. At the excessive concentrations, it damages both teeth and bones. This balance is extremely important. Now let's discuss the recommended intake. Concentration of fluoride in drinking water should be less than less than 2 parts per million. This level is provide protection against dental caries without causing toxicity. Remember this value because it is frequently asked in examinations. Ideal fluoride concentration in drinking water is less than 2 ppm. The major source of fluoride is drinking water. The fluoride content of the water varies from one geographical area to the another. Some regions naturally contain high fluoride levels because fluoride leaches from rocks and groundwater. Tea, seafood, and fluoridated toothpaste also contribute small amounts of fluoride intake. However, drinking water remains the major source. Now let's discuss the disorders associated with the fluoride. There are two situations, one is deficiency and other is excess intake. Fluoride deficiency mainly causes the dental caries. How? The normally fluoride strengthens the tooth enamel. When the fluoride intake is inadequate, enamel becomes weak and bacteria can easily produce acids that dissolve the enamel. Children drinking water containing less than 0.5 ppm fluoride have much higher risk of developing the dental caries. Remember, low fluoride, weak enamel causes the dental caries. Now let's discuss the toxicity. When the fluoride intake exceeds the 2 ppm, toxicity develops. This condition is called as fluorosis. Fluorosis is of two types. First is dental fluorosis, second is skeletal fluorosis. Let's understand each. Excess fluoride during childhood affects the developing teeth initially, while white chalky patches appears on enamel. Gradually, brown discoloration occurs there. Finally, the enamel becomes brittle and pitted, thus the teeth become cosmetically damaged. Always remember that dental fluorosis occurs during the tooth development. Then we will see the skeletal fluorosis. If the excessive fluoride intake continues for many years, fluoride accumulates inside the bones. This causes the abnormal calcification and increased bone density. Initially, patients complain of the joint pain, back pain, stiffness as a disease progresses. Movement becomes restricted. Advanced skeletal fluorosis may produce deformities in spine, pelvis, long bones, and patient may become crippled and unable to perform daily activities. This is why skeletal fluorosis is a major public health problem in some part of the India. The simplest preventive measure is providing drinking water with a safe fluoride concentration, and people living in endemic areas should consume defluorinated water. Fluoride containing toothpaste should be used only as recommended and should not be swallowed by the children. Now comes the most important part for the MBBS examination, that are the biochemical functions. Fluoride is essential for proper development in bones and teeth, and it becomes incorporated into the bone crystals and increases the mineral strength. Fluoride inhibits the certain enzymes. Examples include enolase, which important enzyme in the glycolysis, and fluoride also inhibits aconitase, which is the participates in the citric acid cycle. Although these effects are important biochemically, the major clinical importance for the fluoride is its action on teeth. Fluoride prevents the dental caries. This is the most important function. Let's understand the mechanism. Normally, tooth enamel contains hydroxy hydroxyapatite crystals, and hydroxyapatite dissolves easily in the acidic conditions produced by the oral bacteria. When the fluoride is present, hydroxyapatite is converted into fluoropatite, and fluoropatite is much more resistant to the acid attack. Therefore, tooth enamel becomes stronger. Now, bacteria produce acids, but fluoropatite resists the dissolution. As a result, dental caries decreases significantly. This is the reason fluoride containing toothpaste is recommended worldwide. Fluoride is also inhibits the bacterial enzymes. This reduces the acid production, lowers the acid production, means the less destruction of enamel, and therefore fluorine protects the teeth through the two mechanisms. First is strengthening enamel, and second one is reducing acid production by the bacteria. Let's summarize. Low fluoride leads to dental caries. Optimal fluoride produces strong, healthy teeth. Excess fluoride causes the fluorosis involving teeth and bones. So remember, fluoride behaves like a double-edged sword. The right amount is beneficial and too little or too much is harmful. Let's revise quickly. Fluoride is essential trace element, 99% present in bones and teeth. Main source is drinking water, and safe concentration is less than 2 ppm. Less than 0.5 ppm increases dental caries. More than 2 ppm causes fluorosis. Types of fluorosis are dental fluorosis and is skeletal fluorosis. The skeletal fluorosis causes the hypercalcification, joint stiffness, and deformities. Fluoride converts hydroxyapatite into the fluorapatite, and fluorapatite is the acid resistant. Fluoride inhibits the bacterial enzymes and reduces the acid production. Fluoride also inhibits enolase and aconitase. So that's the full fluorine explained completely from the MBBS examination point of view. If you understood the concepts, revise the rapid revision once before your exams. It will help you retain your topic for a long time. In the next mineral nutrition lecture, we will continue with another important trace element. Thank you for watching and keep learning.